Welcome to ETMC TV and this informative presentation by Dr. Michael Klouda, diagnostic radiologist and medical director of the ETMC Breast Centers. Dr. Klouda will discuss BRCA gene testing for cancers. Thank you for choosing ETMC TV.
BRCA is a term that we use to talk about a genetic mutation condition that exists in some people and some families. And these genes are damaged somehow. They have what's called a mutation. These genes enable, when they function normally, they enable our body to find and correct cancers that develop all the time in men and women. In women with the mutation that we see, the BRCA1 mutation or the BRCA2 mutation, that protein that's associated with that gene is lacking. It doesn't function properly. It doesn't make the correction of a breast cancer or an ovarian cancer that would develop. And so we see these women or these families with early onset of breast cancers or multiple breast cancers, perhaps more than one cancer in a woman, and then ovarian cancer in the family. And we know that when you see these patterns, you need to look for that potential genetic mutation in the family. What we're doing at our breast care center now is offering a screening form that the patient reviews and is able to fill out information regarding their cancer history in their family and their personal cancer history. And if they meet certain criteria, which are criteria put forth by the NCCN, which is the National Committee on Cancer Network, they are then asked if they would care to undergo the genetic testing. We're looking for a pattern that has developed on either the maternal side of the family or the paternal side of the family. If there's 2 breast cancers in the family, one has to be at 50 years or younger, or just 3 breast cancers in the family at any age. Also any male breast cancer, any ovarian cancer in the family, and a particular type of cancer called a triple-negative breast cancer, which is a special designation as to whether or not the tumor cells had certain receptors on them. At the ETMC Breast Care Center, those women that meet criteria for testing, the benefits are reviewed, the actual testing procedure is explained. If they agree to undergo the test, a few forms are filled out, and then we actually now collect what's called a saliva sample that meets a certain volume, and that is mixed with a preservative in a very small tube, and this is sent off in a special package to our genetic testing company. And over 2 to 3 weeks, the result is returned by mail, and the patients are contacted and the results are discussed with them. We know for sure that if we identify an individual whose family has breast or ovarian cancer in that pattern we were talking about, early onset, multiple, and they get genetic testing, the test comes back positive, revealing that there is a mutation. We can then intervene for that patient in several ways, and we're talking about either increased surveillance, chemo prevention of tumors, or even prophylactic surgical prevention. The increased surveillance would entail, say, breast cancer in a 38-year-old woman who's tested positive. We could recommend annual MRI screening and mammography for that individual. We could also have that individual consider a drug like tamoxifen, which we know over a 5-year period, if you have the mutation, that will reduce the development of breast cancer by about 50%. However, many women opt for a surgical procedure where you surgically remove the breasts and then reconstruct them if they so desire, and that reduces their risk to develop future breast cancer almost to zero. The other option we need to keep in mind is that if a young woman has a mutation for the BRCA gene, we would then encourage her to consider a oophorectomy, in which you actually remove the ovaries and the fallopian tubes. And this is done obviously if they've completed childbearing, because we don't have a good way to screen for ovarian cancer. And the thing to keep in mind with ovarian cancer is that usually comes to light when it is advanced, and it is very difficult. It's almost impossible to cure at that point. And truth be told, those women that test positive, they're asymptomatic, they go to surgery, they have their ovaries and tubes removed. Anywhere from 4 to 10% of those women, they discover cancer at the time of that prophylactic surgery. Also, one thing you should know, the BRCA1 and BRCA2 genes, if they have that mutation, their risk to develop ovarian cancer in their lifetime is anywhere from 50 to 85%. If we can pick up that pattern in the family of breast cancer or ovarian cancer, we can make a significant dent in their future morbidity and definitely mortality, keeping them alive from some of these cancers that would definitely take their lives. And not only that, once an individual in a family learns that they're positive and that there's a genetic mutation, the other individuals in her family or his family, they can also be tested. This information can make a big deal, not in just that individual patient's life, but all of their loved ones' lives as well.
BRCA testing is covered by some insurance companies and by an insurance reimbursement assistance program through Myriad Genetics, the maker of BRCA tests. To learn more, please visit etmc.org and search for BRCA. Dr. Klouda is a board-certified diagnostic radiologist and medical director of the ETMC Breast Centers. His office is located at 700 Olympic Plaza, Suite 101. For information or to make an appointment, please call 903-596-3164.
I attended medical school in Chicago, Illinois at Rush Medical College, which is part of Rush University. I then did a one-year general surgery internship following medical school at Texas A&M Scott and White Memorial Hospital. And following that, I did a 4-year radiology residency at Scott and White Memorial Hospital in Temple. And following that, I did a 1-year breast imaging fellowship at the University of Chicago Hospitals in Chicago, Illinois. And I've been here at ETMC running the Breast Care Center for the last 16 years.